welcome back to another episode in my Bulkmas series. Today we are sitting down with Julie, who is a physiotherapist, also known as a physical therapist, who I stumbled across when I am trying to make gains as I've injured myself a little bit. But she's helping me get better quicker. She's going to be chatting with me today on how physical therapy could benefit you. Hi, Julie.
Hello.
How are you?
I'm great. Nice to meet you guys. Welcome to our clinic.
Yeah. So I think a lot of people who go to the gym end up injuring themselves at some point or another, and then they kind of lay off the gym for a while and just let themselves heal because they probably didn't hurt themselves bad enough that they think they need to go to the emergency room or anything. How often do you see these types of injuries, and what would you say to these people in particular?
Generally, we have pretty high direct access here, so we see 40 to 60% of our patients without referrals. A lot of them stumble across us online, or they've heard about us from friends of friends that were runners or CrossFitters. So we have a high endurance athlete community here because I take a special interest in triathlons. So that's something that we see runners with repetitive injuries, we see CrossFitters with overhead injuries from a lift that they tried to do too quickly. I think the thing that I see most common is that people don't know the difference between muscle soreness from a workout and muscle injury. Sometimes they think that it's a normal response to hurt, but that's not normal.
We here in the Adorably Fit community are all about living a active and fit lifestyle. What quick tips can you give us about preventing injuries?
One thing that we do offer here at Results Physiotherapy is free 15-minute screens. So what that is, we're not really doing treatment for you, but we're looking at functional movements. So if you do a squat and I see you blatantly doing something wrong, or if I strength test you or look at your range of motion, I can figure out how PT may benefit you, or sometimes I give some exercises, stretches that people can do preventatively, like for running or lifting or things that basically get them into just normal function, whether some people's goals are reaching up to a shelf, other people's are like snatching a barbell over their head. So it just varies based on personal goals. If people are not interested in PT, a thing I would strongly recommend is that you see a personal trainer who has certifications. I found out that that's something that's not very common. There's the National Academy of Sports Medicine, and then there's also the American College of Sports Medicine that gives great certifications. There's also corrective exercise specialists, so they can help look at movement patterns and make sure that you're doing things correctly.
Sounds like good advice, and I didn't know that you did free 15-minute screenings for anybody, right?
Correct.
That's pretty awesome. So for my viewers who are not lifting weights, what are some other reasons that people come and see a physical therapist?
Great question. So things that people don't normally know that we treat are vertigo. So people who have the room spinning, even just that off balance, unsteady feeling. We treat those. We treat headaches, jaw pain, many people don't know that. Any type of acute or chronic musculoskeletal dysfunction, so that could be you rolled your ankle, you hurt your knee, you hurt your shoulder. Back, we see the spine all the time. We also do manual therapy, so that's like a cliche kind of term in our profession, where we use our hands to work through tissues that are tight, restricted at the joint level, the soft tissue level. That can reduce pain immediately. Can restore range of motion, also improve function. Another tool that we have is called dry needling. Dry needling is a more specific technique that you have to be certified to do.
Do you want to talk a little bit more in depth about what is dry needling?
Sure. So dry needling is an effective intervention that we use a small monofilament needle to address trigger points, which are muscle knots. A lot of people always tell me they have them here and it's always been there kind of thing. But it also can reduce muscle tone. So muscle tone is how much is the muscle firing at rest. Sometimes it's firing too much. So we want to get things equaled out. That can immediately decrease pain, restore range of motion, and get people moving better.
Sounds awesome. Probably not the process while you're doing it, because I've had that done. And
yes.
It doesn't feel great in the process, but it feels better afterwards.
Right. Common feedback from that.
Wow, so I didn't know physical therapy helps with so many things. So next time you've hurt yourself, or you have vertigo, or maybe you even slept on your neck wrong, maybe you could benefit from some dry needling or something.
Yeah, definitely. We do dry needling in conjunction with the usual plan of care. So it's not something that we do in itself, because what happens is there's a reason that you have those muscle knots or that muscle tone there. So our goal is to make you independent of us and teach you the tools to what exercises do you need to do to prevent that from coming back, because otherwise it will come back and then you'll be dependent on us for that intervention.
So again, next time any of those things happen, you can call Results Physiotherapy to get checked out. Or even if that hasn't happened, come in for your free 15-minute screening. And once somebody does call in, how quickly is it before they can be seen?
Yeah, that's a great question. So our front desk is awesome, by the way. But they'll get you in within 24 to 48 hours usually, depending on scheduling and what you need. And then from there, you don't need a referral to come to your first appointment. Our billing department insurances will get verified ahead of time. Some people are self-pay if they don't have insurance. For that, our rate is $120 for an out-of-pocket eval and a $95 per visit, but that's if you don't have insurance coverage.
For those of you who have HSA or FSA cards, it is eligible for you to use that money towards the visit.
Yeah.
Awesome. Is there anything else you'd like to add?
I guess the biggest thing is if people are getting involved in an exercise program, I think it's a good idea to make sure that you are fit enough for that from your primary care doctors as well. Just because a lot of times people will try to go from couch to 5K and they haven't had their blood labs checked or their heart rates and blood pressures and things like that. And all of that can contribute to how you function with those types of activities. So, we are holistic in nature, so we like to be kind of integrated with all the different professionals in the area.
So just touching on something that you just mentioned, people going from couch to 1,000%.
Yeah.
A lot of fitness people out there will be in your face saying, lift heavy, lift heavy. Mm-hmm. And I think a lot of people go straight to the heaviest thing they think and they hurt themselves that way. Yeah. So I don't know, what is your opinion on those out there preaching to lift heavy?
Yeah, loaded question. So you don't want to push yourself to the max all the time. There is a time and a place if you're trying to figure out what your body's demands are capable of doing, but there's also rest and recovery. So optimal healing time is an important thing. Nutrition is an important thing, exercise is important, but you need to have the right balance of all of it. And it can be a very difficult path to figure that out. And a lot of the times the people that are yelling lift heavy in your face are not the ones who know that optimal balance. So
be careful.
So be careful, use your common sense. If it doesn't feel right, it probably isn't right. So
yeah, I think there's a difference between lift challenging and lift heavy, because that can be interpreted different ways.
Yeah, for sure.
So where can people find you online?
ResultsPT.com is our general page within this region. So there's 9 clinics within Raleigh and Durham. We're the only one in Durham, but we're all over Cary, Raleigh, and then we've also got clinics in other states as well. So if any of your viewers are not from North Carolina, that will help them too.
So convenient locations. This one is near South Point, just around the corner from South Point Mall.
Okay, so let me see how you would do a squat.
Okay. I can feel it in my lower back right there.
Okay, and come on back up. Let's try something. It looks like your ankles might be a little bit limited in range of motion. So if we add this underneath your heels, just don't fall.
Okay.
Okay.
Usually I wouldn't be wearing this outfit though.
All right, and then try that again and see if that changes what you feel on your back.
Yeah, that feels better on my back. Yeah.
Good. Yeah, so sometimes with the squat you'll find limitations in either ankle mobility, knee, hip, up the spine, so good.
Should I be doing that all the time? Every squat I do?
So not every squat. Ideally we would work on your range of motion, but it can help you get a little bit more depth without pain.
Cool. So this is just one example of a technique that can help tweak your performance and tweak what you're doing and hopefully get better results. And the goal is also to prevent injury, but also to maximize your performance. Mm-hmm. So if you're looking for a good physical therapist, check out Results Physiotherapy. I will leave their information in the description box below. Thank you everyone for tuning in today. If you like this kind of content, please make sure you give this video a thumbs up and smash that subscribe button
with good form.
So you don't have to come see it. Bye.
Thank you.
Thanks for watching.